Good morning, Dr. Butterfield here. I want to talk about oils and fats in our diet. I've never made a video to talk about this, and it's a really important subject. It's just Saturday morning. I'm just here on my couch with my puppy sleeping on my chest here. So I'm a little casual, but this is really important to address. I'm reading a book by Dr. Jerry Tennant called Voltage Healing, but he's talking about oils here, and he really coincides with what I've espoused in my practice and what I've followed in my personal life. So the main oil that you need to avoid are trans fats. It's not an oil really, because they appear to be saturated. So it's like Crisco or margarine or things like that. So you 100% need to avoid all trans fats for the rest of your life. That is the worst oil. It's a man-made oil. And Dr. Tennant calls them plastic fats because chemically they're very close to plastic. And so they get in your cell, so your cell membranes, every cell in your body is made of fat, essentially. So we need high quality fats in order to build those cell membranes. And he's saying that, it's like wrapping your cells in cellophane if you're using these trans fats. So you have to read ingredients, and it'll say hydrogenated oil or partially hydrogenated. So that's what you got to look out for. Need trans fat free food, and do not be cooking with Crisco or margarine. And I had a patient who was a little upset because I had said this, and socially it's very common that people cook with these, and it's a bit of a social sacrifice that you're not going to be able to eat the same food as everyone else. The other big one that he talks about is canola. Canola oil, for a lot of reasons, is not fit for consumption. Okay. He talks about damaging the liver and causing cancer and all kinds of things. That's really hard because most restaurants are using canola. So if I go to a restaurant, I ask them what oil they're cooking with. Usually it's canola, and I'm pretty limited with what I can eat. So I don't eat out very much because all these restaurants, they're pretty much using the lowest quality food because it's the cheapest. Or maybe there was a demand for canola because it was kind of considered a healthy thing for a while. But you have to stay away from canola. Stay away from most vegetable oils. Certain seed oils, they're considered orexic oils. So you've heard of anorexic is when you don't want to eat anything. Well, orexic oils make you want to eat more. So they've put this phrase on bags that says, like snack bags, say you can't eat just one. Well, that's because they have orexic oils and other preservatives that make you want to eat more and more. Okay? So they're chemically manipulating you. I think it's probably intentionally, so they can have you eat more of their product and they can make more money, and they're hijacking your body. So it's really important to avoid most of those oils. So he's making the argument here that a cell membrane is like a home. So you can have some doors and windows, but you need the house to be strong. And so most of it needs to be strong material. So the strong fat are saturated fats. Okay, so you need 75% saturated fat for your fat in your diet, and about 25% unsaturated fat. So the oils that we use in my home and that I recommend using are, we use butter. Sometimes I'll use lard or leftover bacon grease, although you don't want oil. you gotta be careful reusing oil if it's been cooked at high temperatures. We will eat olive oil as an unsaturated fat. You have your fish oils and omegas are unsaturated fats, so you do need some of those, but it should only be about 25% of your fat. We'll use avocado oil or coconut oil, a lot of butter. He actually made a statement here that if you eat a stick of butter, I think he said a stick of butter a day and 6 to 12 eggs, you'll heal much faster because you have to replace all those cell membranes. He kind of debunks the cholesterol myth that cholesterol causes cardiovascular disease. He goes into more detail on the history of why that it has been pushed so hard in our society, and says it's a myth. I guess I should have given a little more intro to this guy. He was the ophthalmologist who invented LASIK surgery. He's a very accredited physician and very research-based. And there's just not a lot of evidence for the cholesterol myth. You need cholesterol in every cell of your body. Your brain is mostly cholesterol and fat. That's why people who take statins are more likely to get brain diseases and like Alzheimer's and that kind of thing. You need fat and cholesterol in every cell of your body. Okay, you need cholesterol in order to make repairs. You need cholesterol in order to make hormones. Okay, and then your liver produces cholesterol, so it's not just from your diet. Most of the majority of your cholesterol, and when you test your blood, the majority of your cholesterol is from your liver. Maybe about 25% is from your diet, depending on how much you're eating in your diet. So high levels of cholesterol can mean something. It means your body's either trying to make repairs, your body's trying to make more hormones. The liver will, he describes it, the liver washes itself with cholesterol, so you might have some liver damage. It might mean there's some insulin resistance. So it does mean something if you have high cholesterol, but doesn't mean that you should stop eating cholesterol. It doesn't mean that you need to take it out of your diet or you need to take statin drugs. It means something in your body needs that cholesterol. The body has wisdom and wants to use that in the right way. Okay, so I think that's a pretty good overview of what fats to avoid, what fats to include. Cholesterol is not bad. Saturated fat is not bad. That's like a 90s fad. It's not been proven to be the case. And despite using our country doing this low-fat, low-cholesterol program for 50 years and putting everyone on statins, statins is very common that people are on statins, but we're not seeing our rates of heart disease going down. So this isn't the answer. You need to eat plenty of good fats in your diet. He's talking about your body's like 20% fat. Your diet should be at least 20% fat, and more if you're trying to heal your body, your membranes, your nervous system. So focus on those good fats again: coconut oil, avocado oil, butter, lard, olive oil is great. Now you can't really cook with olive oil very much because it has a low smoke point. You gotta be careful about overheating oils, and it's harder to do that with saturated fats. So, all right, good luck, happy cooking.